Hello, this is Tom Knox, and I'm the founder and CEO of CareFamily, and I'm going to welcome you to this webinar on caregiving for Alzheimer's and dementia patients. I want to welcome a lot of the caregivers who work with us at carefamily.com, and we're getting great feedback on you, and we appreciate you be part of the team here that's partnering, working directly with families on helping them with a lot of people dealing with Alzheimer's and dementia, supporting the adult children, the spouses and the senior themselves, keeping them at home and independent, providing a lot of support to the adult children. So you're doing a great job. We want to talk today about understanding more about Alzheimer's and dementia and how to really empower yourself as a caregiver and understand the disease a little bit better. Just to start, what is Alzheimer's? Well, Alzheimer's is a type of dementia that causes problems with memory, thinking, behavior, and just overall cognitive ability, the ability to process information, memorize information, and interact. These symptoms usually develop slowly, unfortunately, and get worse over time, becoming severe enough to interfere with not only daily tasks, but make the person unable to be by themselves in the home. Sometimes people need to move in facilities or need 24-hour care. So it's very important as a caregiver to understand that this is progressive, things change, and you have to really arm yourself to be able to caregive in the right way. What are these changes in behavior we see? And we're going to talk a little bit about the stages of Alzheimer's. But what are the things we see that make it particularly hard for us as caregivers to work with people with Alzheimer's dementia? Well, the first one probably we find is just a lot of times there's aggression and anger. You know, I watched as my grandmother, my father's mother, later in life developed Alzheimer's, and she, my grandmother and grandfather were married over 60 years. Yet later in life, although they were very much in love, she became very angry and aggressive and almost belligerent with him. And watching how he processed that and how hurt he was. And, then people didn't really totally understand the disease. And but, people will change their personalities. And that's what you'll find. You can have the sweetest person in the world that can become very aggressive and angry. And you can have people who, I met one woman who said, my mother and I didn't get along our entire life. She was the toughest woman I ever met. And since she got dementia, she's the sweetest thing. She smiles. And I take her everywhere. So, it's kind of an interesting disease and things can really change. Anxiety and agitation are common as well. I think partially because people know that there's something wrong with them. They get agitated. They're scrambling to remember names, remember things, remember places. And it not only makes them agitated and mad, it makes them embarrassed and anxious. So you'll often find people will have a lot of anxiety, and it's very hard as a caregiver because, quite frankly, it's hard to deal with someone on a regular basis that has this. So we're going to talk about some tips to dealing with people's agitation and anxiety. Memory loss and confusion is obviously very common. People will not remember something that happened an hour ago. Now, they could tell you what happened 30 years ago, but remembering what they did in the morning or what they ate for lunch or if they took their medications is really tough. And general confusion. We have patients who we started giving care to because they got out and started walking to a corner store that they've gone to for 30 years, and all of a sudden they're doing it one day and they get lost and they can't remember why they were walking and where they're going and how to get back to their house. It's very scary. Depression is very common, especially early on when someone is realizing that they are either been diagnosed or they can no longer cognitively carry on the way they did before. So I'll give you a very clear example. I've been around a lot of people who all of a sudden cannot remember names of people that they've known for 30 years. And they can carry on a conversation and you would know something was wrong after speaking to them a little bit, but at first you wouldn't. And so they know that if someone comes up who's not a stranger but a friend and they can't remember their name and interact well, they get embarrassed. So then they don't want to go out and they stay at home and they become a shut-in and they get depressed. It's very important you understand depression can be part of this, understanding the reasons why, and trying to help them cope and get out and not, withdraw is really important in this process. Hallucinations are not uncommon. many of us have probably been on a hospital bed with a friend or a family member or a patient that says, someone came in my room last night and robbed me. There's someone standing in the room. I saw my mom last night, whatever it may be. But, they can be part of the overall behavior. Now, it's important that you look, too, is there other factors? There are medication issues or urinary tract infection that you may want to ask your doctor about. Because if you see a real spike in that kind of thing, where it's not as progressive, but all of a sudden they're acting with hallucinations, something bigger may be wrong, and you want to probably get to a doctor. Suspicion and delusions. We've provided, hundreds of thousands of hours of care. And, you have people who say, all my money's been stolen. These people steal from me all the time. My wedding ring's missing. And you don't want to take those complaints lightly. You need to investigate them as a caregiver or a caregiving organization. But oftentimes, people with dementia are feeling like everybody is out to get them. It's a little bit of paranoia and suspicion. So you want to make sure that, those are being addressed and you're not surprised when they happen. Sleep issues and sundowning are really tough. And, people oftentimes are up every 2 hours and it can be very difficult. But sundowners can even be worse. And where sundowners affects the caregiver, the family caregiver, the spouse, is almost worse. And let me give an example of that. Sundowners is when someone could be up at night, in the middle of the night, where their most active hours become 11 p.m. to 8 a.m. At 1 a.m. they're getting dressed to go to the store. At 2 a.m. they're making lunch. They may be turning on and off burners and coffee makers, and it can become very dangerous. And not only is that dangerous, but if there's a spouse there, the sundowners can be absolutely debilitating and exhausting. Why? Because that spouse who doesn't have Alzheimer's or dementia is up during the day doing a normal routine, and then at night they're not getting sleep because this person is up wandering, and that's when their health slips and their depression comes in, and that family caregiver can spiral out of control and quite frankly could wear themselves out and even die first because of it. So as a caregiver, really important we support caring and filling those gaps so the spouse can sleep. But boy, also being aware that at night that person with dementia or Alzheimer's can just about do anything and try to escape and get out. So you have to be very alert and be awake. And so that's important. You'll find repetition could be something that you see over and over, and it's very unsettling to watch where someone is constantly going over to the sink and pouring a glass of water, taking a sip and walking away, and then going back to the sink and doing it again. Feeling like they have to go get their jacket on, and then you take it off and they go back in and put their jacket on. And it's very unsettling, but repetition can be part of it. And I think, some of it is, and we'll talk about, you don't battle every behavior, you let them do it. If that's what's going to preoccupy them, that could be fine. Wandering and getting lost is also another issue that takes place. And it could be, people are in the house and they leave and they go walk down the street. And unfortunately, if someone's in that condition and they're wandering, doing it late at night can be very dangerous, or in the middle of the night, but also they could wander in a way they're just going to get lost. There are local police departments oftentimes, and I would suggest if you're a caregiver or a family member in these situations, call your local police and ask if they have the GPS tracking systems for people with Alzheimer's, where you could put it in a shoe or around a wrist, and if that person wanders and gets outside of 100 yards of their house, the police will be alerted, you'll be alerted, and you can immediately track them. In our local city here in Virginia, the woman escaped and out of her house, and she was gone for a day and a half, and no one knew where she was. Finally, they tracked her down, and she was in a local psychiatric wing of a hospital because once someone found her on the street, and she couldn't tell her name, where she lived, anything else, and it took the police and the family members to find her. Thank God she was okay, but she could have had something much worse happen. In another case, someone left, and this is someone we took care of before we took care of them, but they left the house and they had a GPS monitoring system on, and they were not out of the house longer than 5 minutes before the police was alerted, sent a patrol car, and found them on their street walking. So you really want to pay attention to those things and do something about it. What are some tips for caregiving? And we put a top 5 here. First one is try not to take the behavior personally. Boy, that's a hard thing to say. But I'm going to give a couple clear examples and as caregivers and as family members. I watched my grandfather take it personally when she was so mean to him when she was mid to late stage Alzheimer's. Probably meaner to him, the husband, who she loved dearly, than anybody else, but he was very hurt by it. And as much as he kind of knew it wasn't her, it was tough. Caregivers often deal with racial slurs, which are inexcusable. They deal with bad language. The adult children deal with all of a sudden their mom doesn't know their name. And people take these things personally. There's no excuse for being abused. There's no excuse for being talked to in a certain way. But what we can do is understand where it's coming from and do not take it personally and then act accordingly. Remaining patient and calm is extremely important. And let me explain to you what I mean. Oftentimes when, you'll see a caregiver with someone with Alzheimer's dementia or an adult child, and the person with dementia is saying things like, we have to go to the store, but it's 11 p.m. Or my mother wants to see me. Well, the mom's been dead 20 years, and it's an 80-year-old woman saying this. And the family will go, come on, Mom, you know that Grandma died 20 years ago. She's not here. Or, come on, we're not going to the store now. It's 11 o'clock at night. What's wrong with you? Okay. That kind of activity or that kind of behavior back to that person with dementia is just not helpful. You're not going to win. It doesn't help them reason. So you need to remain patient and calm and even at times climb into their situation. So it may be something like, you know what, Mom, you're right. We have to go to the store, but boy, let's go when it gets light out. Or, Mom, yes, you're right. I'm sure your mom wants to talk to you, but, I think it's going to be in a couple hours. So why don't we do this? Why don't we get some lunch, go for a little walk, and then we get back, we can hopefully talk to her. Because it's important to kind of climb inside their world. Explore pain as a trigger. Oftentimes people with Alzheimer's and dementia have something wrong with them that they're unable to convey. And so sometimes it takes some probing questions to understand why they're acting the way they are, why they're acting anxious or a little bit belligerent or angry. And it could be because they had a fall and hurt their shoulder. And it takes, Mom, how do you feel here? How do you feel here? Is there anything physically wrong? Is there any pain? And kind of some leading questions to help you get there. I noticed it we kept having, when I first started in senior care 12 years ago or so, I didn't really understand the correlation between getting a bath and shower and dementia. And I realized that people just wouldn't do it. And when we kept digging and digging, it wasn't because they didn't want to bathe. It was because they felt cold, which is very interesting. And but didn't know how to convey that. So after digging and finding that out, we realized, okay, we got to make sure when someone takes a shower, the heat is way up. There's a lot of towels ready that, what are the ways you can do to make them comfortable and make it better? Don't argue or try to convince. We've all probably, those of us in the caregiving field, to sit across the table and watch some sort of dynamic going on where someone's trying to remember something. And, someone says, Mom, do you remember the date you were married? And she's thinking, and come on, Mom, you remember? It was at that beautiful building. It was at this church. You can remember. Come on, you can do it. You may not be able to argue or convince somebody. Give them time. Give them patience. Let them try to answer it. They may surprise you, number one. Number two, it could be a little more of a leading question. Mom, you wore a beautiful dress that day. I remember seeing the pictures. Here's a picture. Do you remember that? Do you remember where you got the dress? Do you remember where you got married? And kind of walk them through and supportive and patience and calm. And it will bring the anxiety level down. And it goes for caregivers and family members. It's really important you try to do that and not argue or convince. Climb inside their world. There's a great assisted living facility that I know about that handles memory support. And one of the things they did inside was they built like a little bus stop inside, a bank, a little kind of bar area. And the idea was that they built a little tiny main street in the body of the facility. And why? Because they could redirect and allow that person to live in their world. If that senior with Alzheimer's said, I want to go to the bank and get money, they could go to the bank, and it wasn't a real bank, but it was something where they could take a little money out, let's say. And in some cases they used, counterfeit money that looked like money, but that person felt like they could put something in their pocket. They'd go sit if that person said, you know what, my mom needs to see me. Well, let's go to the bus stop and we'll go visit, and they'll sit at the bus stop and redirect them. But it's the absolute right type of thing. Accept behaviors as a reality of the disease and try to work through it. Again, the theme, I think what I've been saying is you've got to climb inside, understand what they're try to understand what their experience. Don't take them on. This is part of the disease, and it's your job to kind of work through it with patience and love and support. What are some of the stages of Alzheimer's? Well, early stage Alzheimer's, the person still may be able to function independently and may even be able to be at home. What to expect? Well, there's mild changes in the ability to think and learn. You could see that maybe they used to do Sudoku or crossword puzzles, and they really can't do it to the speed or not finish them like they used to. When you're having a conversation, it's slower. They're forgetting details. There's memory issues with what happened the day before. It continues to participate in daily activities and have a two-way dialogue. It could last years. And so, while they're in that stage, a couple tips. Number one, if you notice something, go to the physician and see if there are some Alzheimer's medications, like let's say Aricept, Namenda, that can actually help them cope with it. You're not going to cure it. You won't necessarily improve it, but maybe you can bring about a little bit extra sharpness and keep the progression a little more limited. And so that's important to do. And what are good activities to do as a caregiver in these stages? Help them keep track of appointments. Encourage them to keep a calendar. Help in remembering words or names, even putting flashcards up and with important numbers or names or places. Things like lock the door on a flashcard or turn off the coffee maker. Help in recalling familiar places or people. I think in the body of conversations, you want to keep reminding them, showing them pictures, keeping them sharp. Keep track of medications. One of the worst things that can happen with someone is in early stages, they're forgetting to take meds on time. They're taking too many medications. We'll talk about some resources for that, but the ability to keep medication management correct can be the difference of catastrophic falls, hunger issues, which lead to weakness. So you want to keep people's medications on time. And planning or organizing, I think you'll find with people in early stage Alzheimer's, they've lost their ability to plan out long-term and short-term, their days, their appointments. So helping in these kind of areas can really help as the caregiver. In middle stage Alzheimer's, and it's probably the longest stage and can last for years, it's more difficult for that person to express their thoughts and perform routine tasks. Making a meal, turning on a burner, cooking something, turning off and making that safe. Locking the doors at night, taking a bath and getting dressed and completely dressing correctly. These kind of things lead to a lot of frustration and anger. Oftentimes this person knows what's happening to them and they're mad. They're embarrassed. They get frustrated with themselves, and as a result, like all of us, when you're frustrated yourself, you sometimes take it out on the people around you. And they could act in unexpected ways. They won't bathe. They used to bathe, and now they're mad and they won't do it. They will not see neighbors they used to see. They will not eat the right food and want to eat sweets the whole time. Ways out of the ordinary. All of a sudden, mom never showed a mean bone in her body, and all of a sudden the language that's coming out of her mouth is totally inappropriate. So you got to prepare for that and be prepared to deal with it. Some good activities are, like I said earlier, use a calm voice. You got to make sure you maybe count to 5 before you say anything or respond, and try to keep your patients about you, and do not yell, scream, because all they're hearing is the yelling and screaming. They're not able to reason what you're trying to say to them. So that calm, slower voice makes a big difference. Respond to the emotion instead of the specific question. The person may simply need reassurance. If somebody is trying to remember a key detail, instead of badgering them into, well, come on, that we talked about it an hour ago and you were there yesterday, it's a little more of a reassurance of, I know, Mom, I have a hard time too sometimes, but boy, do you remember that pizza we had, or that cup of tea that was really good in that warm cafe? you remember I brought my son yesterday. Do you remember seeing him and what he said? Kind of that reassurance, the responding to the overall emotion. Use simple written reminders if the person can still read. I just remember the house that my grandmother and grandfather lived in. They were able to stay in a long time, and my grandmother with dementia lived off the large. They weren't Post-it notes in them, but index cards that were taped all over the place. And boy, it made a difference. I think it kept, honest to God, I think it kept them from keeping doors unlocked and coffee makers on and burners on, and it kept them taking the right food out of the fridge and going to appointments. There's nothing wrong with that. The person would rather have that and feel independent, and as a caregiver, you managing that for them, putting certain things up, even say, I'm doing it for me too. There's a lot for us to track, can be really important. Be aware of changes. A physician should rule out physical problems or medication side effects. It's really true. If changes happen, as the caregiver and you're there on a more regular basis than others, you're going to see spikes and swings that may be out of the ordinary. Urinary tract infections are just horrible things that can take place if someone is not as hygienic as they were, and all of a sudden a UTI can bring about real spikes in dementia, out of the ordinary. And you want to bring someone in to the emergency room of the physician immediately if that's taking place. You'd be able to see that stuff. If people are going on new medications, some of these antipsychotic drugs that people are taking for Alzheimer's or other medications taken in the wrong combination can bring about really bad side effects. They could be mood, they could be balance, they could be strength. And so you want to make sure that the geriatric pharmacist or this person at CVS or wherever it may be, they're seeing a list of meds. The doctor's seeing a list of meds, and you're seeing if there's any complications there that need to be dealt with. In late-stage Alzheimer's, it could be several weeks, it could be several years, but this is where the person, unless something else happens with heart or, it could be what has them die eventually. And what to expect in that? Well, they can as much as even have difficulty eating or forgetting how to swallow. So there could be choking risks. They could be a situation where now they're having pureed food or Ensure because they literally have forgotten, their body cannot respond to swallowing and chewing effectively. They need assistance walking and eventually may be unable to walk, wheelchair bound. They need transferring. They're probably incontinent and need help toileting. They need full-time help with personal care like bathing and dressing. They're vulnerable to infections, especially pneumonia. So it's very important that you're trying to wash hands around them. And if you're not feeling well, wear a surgical mask or don't, get a replacement caregiver that day. And they lose the ability to communicate with words, which is very tough. You'll notice that as people go along with Alzheimer's, their sentences get more fragmented. They make a little less sense until a time when maybe someone just does not communicate anymore. I had someone in my family who towards the end, just wouldn't communicate with words that made any sense. They made more sounds. In her case, she said a lot of ya, 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 ya. And that's what she said. The only thing she could do was sing happy birthday. And you'll have these kind of anomalies that are just really strange. Some good activities, though, are play his or her favorite music. With people now being able to use, iPods and download music, you could get big band music or, stuff from the 20s and 30s. And there's studies that show the responsiveness is really amazing. So giving them the ability to sit and listen to music can be very soothing, and it can actually help them in their brain functionality, at least with alertness. It's not going to cure anything, but you may see a difference in doing that. Read portions of books that have meaning for that person. It could be the Bible. It could be something else. But, don't be afraid to read to them. And even though they can't read themselves, a lot of avid readers love it when people do that. Looking at old photos, talking about old memories is extremely important. Prepare favorite foods. A lot of times people lose their appetite. They don't want to eat anymore, but they had favorite recipes, things they cooked for their own kids. So to bring out those old recipes or favorite food, or even going out, a lot of times people have cravings, or they always like the bagel from up the street or the biscuit sandwich from Hardee's or whatever it may be. Some of those things, they'll eat. And the important thing at that stage is that they are eating. Rub lotion with a favorite scent in the skin. soothing, and the scent can help them. And as a caregiver, what a great gift to give that person. Brush the person's hair. Sit outside together on a nice day. These are calming. These are all things that help the senses and make someone feel loved. And I think at whatever stage, and I don't think I can think of any situation, unless the person was literally not in a conscious state, that the love, the touch, the feel, the music, the environment didn't play in some part into their overall state of mind. Tips for communicating with Alzheimer's patients, people, using familiar words repeatedly, using names repeatedly that people know, inventing new words to describe familiar objects. That is something that Alzheimer's. Actually, John, I'm going to redo this. This page. So let's talk about some tips for communicating with Alzheimer's patients. Person will have changes in their communication at all stages of Alzheimer's. Using familiar words repeatedly. You'll find their vocabulary will get less and less robust in a sense. So they're going to use same words over and over. And inventing new words to describe familiar objects, which is jolting oftentimes to the family member or the caregiver. But play through it. Mom, let me ask you again, what is this here? And if you can tell them, you know what, it's also called a cup, or whatever it may be. You don't have to debate them and challenge them. You could talk about what it's also called, but be aware that some people who get dementia will start to use almost their own language. Also, they may revert back to an original language. So if someone's Italian or, from Hungary. We had someone from Hungary who began using language that they had as a young child. Easily losing his or her train of thought, being in the middle of a step, a process, a walk, a task, and literally in the middle of it saying, I don't remember why I'm here or what I was doing. They're having difficulty organizing words logically. You'll find a fragmented sentence structure. You'll find missing adjectives or nouns or verbs. You can help them with that. Encourage them. I wouldn't necessarily always make them aware of it. You want to just continue the conversation because they will eventually start to speak less often, but you want to encourage as much as communication while they can. So what can you do to help? Well, be patient and supportive. It goes back to, again, not challenging, not debating, not showing embarrassment or anger, but being supportive and being suggestive and climbing into their world a little bit. Offer that comfort and reassurance and avoid criticizing and correcting. You want to avoid the arguments like, Mom, you're not going to see your mother tonight. She didn't see you in your room last night. She died 20 years ago. You and I were both at the funeral. Doesn't help. Again, it's back to, you know what? Hopefully you'll see your mom tomorrow. Let's see what we can do. Let's go and have dinner now, and let's talk about it after dinner and redirect. Offer a guess. What that means is, as the person is trying to talk, help them work through it. If they're saying, I really want, we could say, are you wanting to eat something, Mom? Are you wanting to go somewhere? Are you trying to wear a different piece of clothing? Are you in pain? And continue to ask questions and lead. And you don't have to yell, but you may want to speak clearly and close to them and let them see your lips moving. People feel like if they yell more, it helps. It's not often a sound thing, it's a clarity thing oftentimes. Encourage unspoken communication. We talked about the importance of feel, touch, massage, lotions, hair being brushed. All those kind of things are really important. Limit the distractions, whether that's noise, whether that's too many people. Limit the distractions that could be confusing or overwhelming to that person. And focus on their feelings and not the facts. Again, they're not going to get the facts right. In fact, they're going to get worse. But what you're trying to do is help them with how they feel, their anxiousness, make them feel loved, support them in getting answers, encourage them when they get it right. That's really the key. There are some excellent resources out there as a caregiver and as a family member. The Alzheimer's Association is just a phenomenal organization. From a resource perspective, you can go to alz.org or communityresourcesfinder.org. They have offices and chapters throughout the U.S. There's a 24-hour hotline, and you can call 1-800-272-3900. If you're a caregiver, a family member, someone who's just been diagnosed, no better organization out there to really key in on a lot of this. Also, I want to encourage you, if you need it and you're overwhelmed as someone with Alzheimer's, or you're carrying someone with Alzheimer's, you have a loved one with Alzheimer's, some of the support groups the Alzheimer's Association has can be really helpful. And the 800 number, which is a 24-hour hotline, can not only provide some counseling, but can direct you in your area to places to get more guidance, counseling, and support groups. CareFamily.com is full of videos, webinars, white papers, blogs that we've done on all areas of senior care, and with a really heavy emphasis on dementia and Alzheimer's. So go to info.carefamily.com and look around, and you can also ask us questions. We have an Ask an Expert question area on our site in that resource area. But also, as you're looking at this, at the bottom of this page, there is an area to put questions to be answered. And so if you just type in what you want, we'll be back to you in 24 hours. And we're also going to answer 3 questions tonight from people who have written in. Online education, which for caregivers, again, really important. If you go to alz.org, they do have e-learning workshops, training, certification, books, and DVDs to continue to encourage you in getting better at your care with Alzheimer's. Also, people who hire, whether it's agencies or family members, you're much more valuable, you're a better caregiver if you get full training. CareFamily.com offers free courses, and these are actually caregiving courses that can be used for continuing education, and we have over 20 hours of Alzheimer's training. We even have a full Alzheimer's training course, which is about 23 hours. If you log in, it costs nothing. You can register as a caregiver or a care seeker on our site and go into your e-learning section of your dashboard, which we're going to show you, and you can find great classes. CareFamily.com, you can see here is your e-learning section. And you'll find it's easy to access from the CareFamily dashboard, and you can register at carefamily.com if you haven't already and access these courses. They are currently free. In the open market, they'd be anywhere between $15 and $20 a class. And let's give you an example here of a course. You can see there's an online course. It's Advanced Memory Care section, Memory Enhanced Activities number 3. And you can see on the bottom here, the offering, people with dementia have genuine valid reasons for disliking the bathing process, and we explore those fears and hesitations together. Then we'll brainstorm in search of a new understanding and uncover ways to approach the bathing process to make it a better experience. So that's a great example of about a 45-minute to 1-hour course. You'll get a certificate when you're complete that gets you a better background and baseline and foundation for Alzheimer's care. So we highly suggest you go to your dashboard and take the class with us. Lastly, I would just want to say that, my story, our story, is your story. I got into this because I had a grandmother who was neglected in a facility. I had another grandmother who did have Alzheimer's, and I watched what it did to her husband. But my mother, when she was in a nursing home, had a bad experience. And so we moved her home. And my mom took care of her 24/7 until she had a nervous breakdown. It was at that point I decided I was going to get into the caregiving field and really help try to find solutions to caregivers wanting to work in this field and family members looking for solutions to stay at home. In this picture, it says 4 generations at the bottom. It's actually 5. I'm the baby being held by my great-great-grandmother. Next to her is my great-grandmother, my mother, and my grandfather. My mom put that picture in my office to say, I want you to remember why you're doing this, why you started a company, why you're helping caregivers across the country do this, and for family members who need real help. And it's a blessing to know that I had 5 generations that I knew. And in fact, the woman holding me I knew up through the time I was 8 years old. That was my great-great-grandmother. We want to thank you for coming to us again at carefamily.com, and we're going to go ahead and answer 3 questions that were submitted to us. All from caregivers. The first one is from a caregiver asking about medications and managing them. And her question was, I help the person during the day, and I remind them to take their medications when I'm there, but what happens when I'm not there? And just a couple tips I have for that is, number one, if you have a pill box or something that can track if someone's taking medications, that's a good thing, because when you're gone, You want to be able to see whether they're at least taken or not, if they're moved around. Problem with people with dementia or Alzheimer's, they often try to still manage their own meds. And if they're not locked away somewhere or organized specifically, it can bring about a lot of problems. At CareFamily.com, we do offer a free medication reminder system that caregivers or family members can use, that by setting a time during the day, our system will actually call the family, the senior, and remind them to take their medications. And it will do 2 attempts if the person doesn't answer the phone. And when the person answers the phone, it will remind them to go ahead and take their meds. And for a compliant senior who just needs to be reminded, it helps them keep the meds on time. And if the person does not answer the phone, it will actually alert the family or alert the caregiver that the person did not take their meds, and that person can intervene. But maybe more importantly, the person didn't answer the phone and needs help. The next question had to do with family members, often the spouse, that is really worn out and the caregiver is just coming sporadically. And I think my counsel there would be what I often tell a lot of adult children or spouses of someone with Alzheimer's or dementia. And it's very similar to the story when people get on an airplane and the flight attendant is saying, before you take care of your loved one, your child, in the seat next to you, you've got to put on the oxygen mask yourself. And that is because you can't help anybody else unless you're healthy and breathing. And oftentimes people burn out, caregivers get burnt out, adult children burn out, spouses burn out. It's very important that you create time in your life and your schedule that gives you rest, gives you peace, gives you a time outside of the disease or the caregiving. It could be going to see your grandkids. It could be going to lunch with friends. It could be volunteering at the library. It could be going to a movie in Starbucks. But you kind of know once a week. It's every Thursday from 9 to 1. It's Tuesdays and Thursdays from 1 to 5. And I get my hair done here. I get to go to the store here. And having those little anchors of respite as a caregiver, as a family member, can make the difference of you being long-term or whether you burn yourself out, have to quit, or quite frankly, pass on before that spouse does. And the last thing is, we got a question from a woman who is a companion caregiver, meaning she is not trained in professional senior care, and wondered if I am a companion homemaker and I'm used to doing chores and driving and cooking, but now that person I've been caring for needs bathing and dressing and incontinence support because her dementia and Alzheimer's is progressing. What do I do? And I have a couple key suggestions. Number one, don't be afraid to get continuing education. There's a couple ways you could do that. You could go get a certified nursing attendant or nurse's aide class. Go online in your local area and you can put in nurse's aide classes, CNA classes, LNA classes. And what that will do is tell you your options for taking a course. Secondly, you could go online at CareFamily.com and go into our university and take courses. There's a 32-hour caregiving course. It's not recognized by every state because it's an online class, but if you want a baseline and want to be hired privately by a family, it's an excellent way of giving you a universal look at caregiving in general. So you want to get your training up and doing that. And lastly, don't be afraid to work or shadow another caregiver and watch how they professionally bathe or lift or transfer so you can hone your skills as well. So I think those are the questions we'd like to answer now. Again, if you have any questions yourself, go to the bottom of this page, and we can help you with any question you have. We'll answer it within 24 hours, and we thank you for joining us today.